A lab technician prepares Frizzell for a brain scan.
You don't have any allergies either?
He intrigues researchers because of the cold-blooded nature of his violence, especially during the most serious crime for which he was convicted, the killing of his hold-up partner. Prosecutors say Frizzell clubbed his accomplice with a rifle, gave him an overdose of drugs, and threw him in the ocean. Frizzell says he didn't do it.
What I'm going to do is to take you into the scanner.
But you're saying you're not guilty of going in and killing him?
No. No, I can't fathom doing something like that, like killing for the sake of killing or killing to do whatever. I mean, I'm not proud of what happened, you know, and I feel for the fact that he's no longer here, and, you know, maybe I could have done something to stop that.
They have superb verbal skills often. Very glib, very smooth, very charming and manipulative.
Which they could be using, you fear, to con you, then?
Oh, yes. Oh, yes. Oh, yes.
Johan Brink is clinical director of the psychiatric prison where Frizzell is serving time. He says Frizzell is a psychopath, an especially dangerous type of criminal.
You can lie up on your bed.
Psychopathic individuals lack a sense of remorse and empathy. They seem to lack, at a core level, a sense of true reciprocity.
I think maybe I do demonstrate some of the traits that are inherent in a psychopath.
What traits would those be?
I have no idea. I think that maybe one of them is that if I'm in a cycle of abusive behavior, I would dehumanize people. It would make it easier for me to victimize them. So that's very true.
The psychopaths, you can't read the numbers across the bottom. Yes, you can if you look way, way down.
The test Johan Brink used to diagnose Patrick Frizzell a psychopath was developed by this man, Robert Hare, who teaches psychology at the University of British Columbia.
It helps me to conceptualize these individuals as predators, and it helps in a number of different ways. I'm trying to understand how it is that somebody is able to commit a dispassionate act without any signs of remorse, no pangs of conscience and so on, and act as if it was ordinary act. It's like having a cup of coffee or going out and buying a car.
Are you okay?
The emotional implications for these people of a violent act or an act that uses or abuses other people are really quite trivial. You can think of their behavior as that of a predator to a prey.
So working from bottom up.
Hare's diagnostic checklist is used around the world to reveal the psychopaths among us. Now he wants to move beyond identifying them to learning what makes them act the way they do.
So here we have cold-blooded, dispassionate behavior that seems very difficult to understand, and we're trying to relate this now to underlying neurobiology, and I think that probably quite rarely, I suppose, in the area of psychopathology, I think we're able to do that.
Underlying neurobiology, he said, something in the brain. Something which might be revealed by this magnetic resonance imager. Hare and a radiology team at the University of British Columbia are using it to scan the brains of convicted psychopaths.
Okay, so we will do a oblique axial T1.
Their first volunteer, Patrick Frizzell. This is how the computer sees his brain while he is lying in the MRI.
Psychopaths probably process and use most information, neutral or emotional, in a very superficial manner. And the argument here is that the parts of the brain that would typically impart deep semantic meaning to language or to thoughts and attitudes, or deep emotional meaning, are very likely not really effective. And we suspect that in the psychopath there's something amiss here.
This is the cerebellum at the back of the brain, and these are the temporal lobes here.
The first thing revealed by the MRI is that there is nothing amiss with the structure of Patrick Frizzell's brain. No abnormalities in the way it is built.
What happens when you stimulate the brain with a stimulus of any sort, for instance, a visual stimulus? Certain neurons, certain cells in the brain are activated, and blood flows at a greater rate to that area. We can detect those changes in blood flow with functional MRI techniques. Region of amygdala in there.
Forster usually interprets the bright spots and shadows on these magnetic resonance images for patients with medical problems. Now, Forster and Hare are searching for more than disease in some brain scans. They seek clues to behavior.
26 field of view.
Behavior simply does not occur by itself. It is under control of the brain. And we're not going to understand behavior unless we look at brain function and behavior at the same time, simultaneously.
We hypothesize that in psychopaths, there is less activation in the brain cells themselves in the areas that control emotion.
And, says Hare, if psychopaths don't register emotions normally, that helps to explain how they are able to victimize others so effectively. They don't feel any remorse.
But what's really going on in the mind of the psychopath? To answer this, Hare turned his attention to how the brain of a psychopath processes and uses information compared to the brains of individuals without the disorder. One measure of brain function involves the recording of brain EEG patterns while a person presses a key to indicate a distinction between non-words, neutral words, and emotional words. Psychopaths seem to process linguistic, semantic, and emotional material in a very superficial way, lacking affect. They do not relate to situations which, for most people, have emotional significance. Emotional connections seem to be lacking. In this test, Frisell's reaction time is the same for all three groups of words and non-words. Whereas most people would show an emotional reaction to words like cancer or death, compared to table or book, the psychopath reacts as if they were all the same, devoid of emotion. One of the most convincing studies of the brains of psychopaths involves single photon emission computerized tomography, or SPECT. In this process, harmless amounts of radioactive tracers are injected into a subject's bloodstream. Activity in specific areas of the brain can then be observed. The white and red colors indicate the areas of highest mental activity. The green and blue colors indicate less activity.
The SPECT study was done in New York at the Bronx VA Hospital under the direction of Dr. Joanne Intrator. And it was really the first of its sort ever done. Nobody had ever looked at psychopaths before in this particular way. And the task was the lexical decision paradigm. Again, a letter string flashed on the screen will either form a word or it will not. And you decide as quickly as possible if you see a word by pushing a button. And some of the words are neutral in connotation, some are emotional or affective in connotation. And we know from other studies that normal individuals process neutral and emotional information differently. We also know from event-related potential studies measuring EEG in a lexical decision task that psychopaths actually differ from normal individuals in the way they process this sort of information. To make a long story short, the psychopath seems to interpret, process, and perhaps use emotional information as if it was neutral information. So the brain potentials that we would record from the surface of the scalp, from the surface of the skull of psychopaths, would look the same to neutral as to emotional words in this lexical decision paradigm, which is quite intriguing, and it tells us that perhaps the psychopath doesn't really extract emotional information from words in the same way that most other people would do. So this led to the brain imaging study, the SPECT study done in New York. The normal individual, the non-psychopathic individual, shows widespread activation of the brain in performing this particular task, which makes a lot of sense when you think about it. The task is simple on the surface. Is it a word? Push a button. But on the other hand, the brain processes involved are very complex. Many different parts of the brain have to be activated. And this is exactly what we find with the non-psychopathic individual in this task. And it's represented by widespread activation in the brain, indicating that language areas are highly activated. You can certainly see them in the slides. And some activity towards frontal part of the brain. In fact, there's a very nice anterior-posterior gradient where most of the activity is towards the frontal front part of the brain. Also some activity on the right side as well. Now, for the emotional words, which are all negative in connotation, we see that there's fairly substantial activation in the right hemisphere as well, which is not unusual. We know that the right hemisphere plays an important role in processing negative emotion, negative affect. If we look at the psychopath, we get quite a different picture. And in fact, the slides themselves are almost too dramatic. People would look at them and say, well, there's something wrong here. Are you really looking at somebody who's awake and alert and active? Well, in fact, these individuals were active. They were performing the task as well as the non-psychopaths were performing, but different parts of the brain were activated. You can see quite clearly that, in fact, the part of the brain that was activated most was the occipital cortex, the back part of the brain. Now, this is rather intriguing when you think about it. Well, the input is visual, so much of the information is going to the back part of the brain for initial processing. And then, of course, presumably it should move forward, backwards, up, down, and around different parts of the brain. But this doesn't seem to be happening here. With the psychopath, the task is being performed primarily in the posterior parts of the brain. Now, we know from other studies involving brain imaging studies that, in fact, it is possible to make a decision about whether or not what you see is a word in the posterior part of the brain. It's not necessary that other parts of the brain become highly active, but it's pretty hard for a normal individual to see a word like cancer or rape or death without actually drawing all sorts of other associations, cognitive affective associations. You may have an image, conscious or subconscious, of what's going on. You may think of somebody as, oh, do I have cancer? All these different things. And this would activate other parts of the brain. For the psychopath, that seems to be seems not to be the case. It's as if the task is very straightforward. Is it a word or not? Who cares what it says? I'm going to process it in the same way in a very superficial manner.
Identifying some of the characteristics of psychopathy raises the question about whether or not this behavior can be changed. Is there a way of treating those afflicted? One treatment technique has involved group therapy for some psychopaths serving prison terms for violent crimes.
So most of the treatment programs that have been developed in the past have tried to treat or to change or modify some sort of subjective experiences such as anxiety, lack of self-esteem. These are all wrong for the psychopath. The psychopath doesn't have these problems. His problems are that his behavior is at odds with what society considers to be acceptable. So we're going to have to figure out ways of actually changing this individual's behavior. So the standard programs that we use in the criminal justice system in most prisons are really geared to the average offender. These are people that have problems of various sorts. It could be that they have lack of education, poor reading skills, poor interpersonal skills, too much anxiety. We can treat these things. And the programs are typically reasonably successful for the average offender, but not for the psychopath.